Are we performing unnecessary surgeries? A new study in the International Journal of Research in Oncology challenges our current approach to endometrial polyps. This research, authored by Gali Levy from the Galilee Medical Center, examines the true malignant potential of these common gynecologic findings. Endometrial polyps are frequently detected during routine gynecologic imaging, often incidentally. The central concern for clinicians is their malignant potential, particularly in determining which patients require surgical intervention. Wide variability in reported malignancy rates has historically led to aggressive surgical management practices. This study evaluates the risk profile of asymptomatic polyps and examines if current surgical patterns align with actual risk. A retrospective cohort study was conducted on 172 women diagnosed with endometrial polyps at a tertiary medical center. Researchers analyzed clinical presentation, hysteroscopic findings, and detailed histopathology for every case. Established oncologic risk factors, including breast cancer history and tamoxifen use, were meticulously assessed. The associations were analyzed using rigorous statistical methods to ensure the accuracy of the findings. The results were revealing. Of the 172 polyps removed, 163, or nearly 95%, were entirely benign. Only 8 cases, representing 4.7% of the total, were identified as malignant. Crucially, no malignancies were identified among the asymptomatic women in the study. In contrast, symptomatic women with vaginal bleeding demonstrated an 8.8% malignancy rate. This difference was highly significant, clearly identifying symptoms as a primary risk indicator. Asymptomatic patients were more likely to have a history of breast cancer. They were also significantly more likely to have used tamoxifen. Yet, these factors did not translate into increased malignancy in the absence of symptoms. Importantly, the study found that surgical management itself carried measurable risks for the patients. Uterine perforation occurred in 1.75% of the procedures. Hospitalization was required for 2.33% of cases, and some patients even required transfusions. This study demonstrates that asymptomatic endometrial polyps carry negligible malignant potential, even with traditional risk factors. The findings underscore the need for risk-stratified management, supporting conservative surveillance for incidentally detected polyps. Symptomatic presentation, particularly abnormal bleeding, remains the most clinically meaningful predictor of malignancy. Visit our website for the full manuscript and follow SciVision publishers for more oncologic research updates.